It's actually early in the morning, and actually I just woke up, but I have been moved to share my thoughts on the role of fasting in reversing diabetes. For the past few days, I have been talking to people who have been afflicted with diabetes. Records show that about 4 million Filipinos now are afflicted with diabetes. Compare that with the number of people na na-infect ng COVID-19. I think as of yesterday, about a little over 400,000 Filipinos nagka-COVID. At ilan ang namamatay because of diabetes? About 25,000 people every year namamatay because of diabetes. Ilan ang namatay thus far because of COVID? Only about 7,000. So diabetes is a major concern today in the country. Now the sad part about diabetes is most doctors would say now that diabetes is incurable. Kaya anyone who's afflicted with diabetes, talagang lifelong relationship yan with metformin and insulin. And for the males out there, it's a lifelong struggle with erectile dysfunction. This will be a 3-part series on diabetes. Yung first part would be mainly a discussion on what diabetes is. And then yung second part will be a discussion on the current conventional way of treating diabetes. Okay? And then yung third is yung discussion on how we can reverse diabetes. The question is, what is diabetes? We have to remember, every time we eat, especially when we eat sugary foods and carbohydrates, our blood sugar goes up. Yung tinatawag natin glucose. Glucose is our blood sugar. So it goes up. And it puts our body in disequilibrium. Our body has been beautifully designed such that if any disequilibrium occurs, there is an automatic mechanism whereby our body is put back into equilibrium. That is why we can actually eat anything, any amount of carbs, any amount of sugary foods. And then later on, may babalik lang sa normal yung equilibrium ng katawan natin. May babalik lang sa normal yung blood sugar natin. Because as I said, our body has been beautifully designed such that there is an automatic mechanism whereby everything is put back in equilibrium when our body is in disequilibrium. Whenever our blood sugar goes up, our pancreas produces insulin. At ang ginagawa ng insulin is to take away the excess sugar or the excess glucose in our blood. At dinidistribute yan sa iba-ibang parte ng ating katawan. Because each and every cell of our body requires glucose, requires blood sugar for them to function properly. So ang role ng insulin is kukunin yung excess blood sugar, dinadala sa iba-ibang parte ng ating katawan. So every time our blood sugar goes up, automatically, instinctively, our pancreas produces insulin. Kukunin yung excess glucose, excess blood sugar, and it puts back our blood sugar at normal levels. Unelevated blood sugar per se does not constitute diabetes. Hindi ibig sabihin na dahil mataas yung blood sugar natin, may diabetes na yung tao. Because remember, every time we eat, pati na yung newly born baby, yung bata, mabata ka man, matanda, okay? Every time we eat, our blood sugar goes up. Nagiging problema lang yan once our body starts resisting the normal level of insulin that is required to bring the excess sugar, blood sugar, to the different parts of our body. As insulin is unable to get the different parts of our body to receive the excess blood sugar, then our blood sugar will remain elevated. The resistance put up by our body against insulin, which is what we call as insulin resistant, is what keeps our blood sugar elevated. Ang insulin para yang isang kolektor, no, ng utang na pupunta sa bahay mo. So pupunta yung kolektor at sasabihin, dapat bayaran na itong utang mo. And so you will entertain. Now, pupunta yung collector Monday, pupunta siya ulit Tuesday, entertain mo pa rin. Pero pag araw-araw na lang pupunta sa bahay mo, pupunta umaga, tanghali, hapon at gabi, para kukulitin ka. After a while, you stop entertaining the collector. Pagsasabihan mo na lang yung ibang tao sa bahay na pag dumating yung collector, sabihin na wala ka because nakukulitan ka. That's exactly what happens in our body. Pag ang insulin palaging nagdadala ng excess blood sugar sa iba-ibang parte ng katawan natin, after a while, yung iba-ibang parte ng katawan natin will start resisting. They will resist insulin now. Yeah, insulin resistant na sila. Because nakukulitan sila. Now, the only way for a collector to force you to entertain him is perhaps magdala pa siya ng ibang kolektor. Marami sila. Mag-iingay sila sa labas ng bahay mo. At sabihin, nandito kami. So then, bubuksan the same thing with insulin resistance. Pag resistant na yung iba-ibang parte ng katawan natin, it takes more amount of insulin for our body to receive insulin. So, kaya anong ginagawa? The doctor would prescribe medications that will make your pancreas produce more insulin. That's what metformin is for. It forces the pancreas to produce more insulin to overcome the insulin resistance of the different parts of our body. That is what insulin resistance is. That's what diabetes is. It is insulin resistance that keeps our blood sugar elevated. Without insulin resistance, pag tumaas yung blood sugar natin, pag wala lang insulin resistance, automatically, it goes back to normal. Bakit? Because, as I said, every time our blood sugar goes up, our pancreas would produce the sufficient insulin to bring it down. Ang problema lang is when our body becomes insulin resistant. Okay? Now the question is, what causes insulin resistance? Now, to answer that, ang tanong is, what triggers the production of insulin? Remember, what triggers the production of insulin is pag kumakain tayo, especially carbohydrates and sugar. Now, ang problema ngayon sa panahon na ito, people are eating continuously throughout the day and even sa gabi. So people take breakfast at bago pa mag-lunch, may merienda. And then after lunch, may merienda na naman sa hapon. And then after sa hapunan, meron pang merienda. Tinatawag natin midnight snacks. At bukod pa dyan, in between meriendas, ang daming sitsirias na kinakain. Mani, chips, donuts, at kung ano-ano pa. At bukod dyan, dami pang iniinom. Soft drinks, iced tea, milk tea. So ang nangyayari, if you recall our analogy, yung collector nangungulit, and sa kakulitan ng collector, we start resisting the collector. In the same manner, dahil kain ang kain tayo, and every time we eat, the pancreas produces insulin at dinadala ni insulin sa different parts of our body. So, the different parts of our body becomes resistant to insulin. Nakulitan sila kay insulin. Bakit? Sabi niya, palagi ka na lang nandito. I don't like your face anymore. That's how insulin resistance is developed. The constant, continuous eating, especially of carbohydrates and sugary foods. So we'll end our discussion on fasting and diabetes at this point, and then sa second part, we'll discuss kung ano yung conventional treatment, no, ng diabetes. And then sa third part, okay, we now explore the role of fasting in reversing diabetes. Thank you.